Welcome to this week's video. Today we're going to be talking about the 7 questions you must be asking when starting a validation exercise. So question 1, why are you doing a validation exercise? Is it that you already know your KOLs well, but you want an unbiased sense check from an independent party? Or maybe you've been in the therapy area for a long amount of time, you want to make sure you're progressively engaging with different types of experts, you have the same individuals on your list all the time, so it's important to make sure that you're refreshing that list often. All these kind of questions are important to take into account when beginning such an exercise. And question 2, what do you want to know from the validation? Do you simply want to kind of refresh your knowledge, all the kind of expert profiles you have in-house, or perhaps do you want a holistic overview of the list from kind of a top look down, answering 3 kind of important questions in terms of who should stay on your list, who should go, and perhaps who should join that list as well. So question 3, how's the outcome going to help you? So simply, do you want to keep your data up to date, or are you looking to redo your engagement plans, and often having the most relevant or pertinent information on hand at the right time is going to be very important to planning those engagements over the next quarter or next year or so. And then question 4, what methods do you want to use? Obviously, there's the predominantly quantitative side of the research where you're looking at things like publications, clinical trial activities, congress activities, membership on editorial boards. Those can build a very quantitative ranking and scoring of those experts in terms of relevance and influence throughout the field. But then also we can combine that with qualitative research. So this is looking at speaking to experts directly, getting very qualitative, very subjective views on who is the most influential experts in the landscape. So combining those two is often a very important validation of the data, to kind of combine both the qualitative and quantitative into a scoring matrix that can help you make the most appropriate decisions on your engagement plans. So question 5, are you considering resegmenting or classifying your experts? This is an important exercise for when we do a validation, to make sure that the expert is characterized in the right way, which is going to help you to build your engagement plans over time. So perhaps they're more suited to an activity like advisory boards, or whether they're more suited towards the clinical development side of things. It's important to know which bucket those experts fall into to help you build your engagement plans at the end of the day. And then question 6, are there any specific future opportunities to which you're seeking KOLs actively? So whether or not you're just refreshing your existing knowledge, doing a validation exercise can help you in terms of perhaps if you have a new product coming to market in the next few years and you want to make sure you're engaging with the emerging experts or rising stars in the field that are perhaps going to be the leading experts at the time of launch. It's an important exercise to undertake to make sure that you are staying up to date with the landscape, and all of these activities are taken into account in your engagement plans. And then finally, question 7, have you engaged with a specialist vendor whose complete world and work surrounds this? And if the answer is system analytic, then it is a yes. Thank you for watching.